Hello and welcome to Living Her Legacy, a podcast that celebrates and serves mamas who are choosing to live their best lives after starting their families. I'm your host, Jill Sutton, and thank you so much for joining today. Definitely feel free to jump over to YouTube. You can watch this one on Jill G. Sutton. I'm also going to be posting this one on my Josh and Jill on the Hill YouTube channel as well, because I'm changing things up a little bit today. The plan was to kind of talk about daycare as Jet is in his third week of daycare, but we ended up having an appointment yesterday and I kind of wanted to go over it and give a little bit of a backstory for those that don't know about it. So I'm going to intro in our YouTube channel now, and that way I have it all recorded on one video, but this is our story with Jet and his cardiology appointments. Hey YouTube fam, welcome back. I realized after I posted our video yesterday of Jet's cardiology follow-up appointment that there really was no backstory, and when Josh and I were talking, obviously the audio quality was not very good. I had put the lav mic on Josh and he's not as much of a talker as I am, so you could pretty much hear car noise and it might have been hard to listen to. So also what I felt like was, after editing it, was that was kind of our immediate response and hashing things out together. We hadn't talked, we had literally just got in the car in the parking garage after the appointment, and we had been just unloaded with information. The doctor, she is such a blessing, a beautiful soul, spent so much time educating us. But it's just so much information. It's a lot of terminology that we don't know, and trying to figure out what's best to do with our 6-month-old son. So I wanted to give some backstory and also explain a little bit more about what Jet has, the best that I can. I'm a physical therapist by background. I have some medical knowledge, but I'm not going to by any means tell you that I am a heart or cardiac expert. This stuff is pretty foreign to me. I've looked stuff up on my own, but really it's what the doctor is educating me on. So Jet, our son, was born in July, and like every baby, hopefully, born in the hospital in the United States, they get a very thorough assessment by a pediatrician. And during that assessment, he was found to have a heart murmur. When they have a heart murmur, it's more of like an extra sound that the doctor can hear when they're listening to their chest with a stethoscope. And it's just a change in blood flow in the heart that they're hearing. It can be fairly common in newborns and can really have no cause for concern. But our pediatrician ordered an echocardiogram, which is a heart ultrasound. We have the echocardiogram, which is about a 45 minute test where they're taking that ultrasound of the heart and they send all these pictures to a pediatric cardiologist who then reads all the pictures and gets back to you. And we found at a day old that Jet had 2 openings in his heart that typically close when a baby is born. So they are supposed to be open in the womb. It is a God-given miracle that they close when they're born and that everything works fine. So the 2 openings that Jet had were a PFO and a PDA. I'm probably going to butcher this, but the PFO was a patent foramen ovale. If you look at a heart or a picture of a heart, an actual heart, not this heart, right? Which way am I supposed to do it? If you're watching on YouTube, you can get a good laugh at me. It's a 4-chamber heart, 2 upper atrium, 2 lower ventricles. The PFO is a hole that goes between the 2 upper atrium. So that is supposed to block off, seal itself at birth. So that one was still open. The PDA is a hole between the 2 main blood vessels leaving the heart. So not exactly the heart itself, but the 2 blood vessels that are leaving the heart. The pulmonary artery and the aorta. So that had a little hole. So when they pick it up on stethoscope, you can hear like maybe a swishing or a sloshing sound. So a little bit more than what they want. And that's what they call that heart murmur. So once we got discharged from the hospital, it wasn't something they had to do immediately then. These things can spontaneously close. Usually a good forceful cry of the baby can close the hole. Again, I'm not a specialist. This is just what we were educated on. But this is what we were told. So we went to our pediatrician. She could still hear it. And so she said, come back in 3 days. And if it's still not closed, I'm going to refer you to a pediatric cardiologist in Charlotte. And of course, we go back, and it sounded like it was getting less. Honestly, I can't remember if she said it was less strong or more strong, because as it closes, it's either more defined. But anyway, it was getting better. It seemed like it was progressing better. But she still wanted to send us because here Jet is less than a week old, and he's got this heart murmur. And so we went up to Charlotte the next week. He was about 2 weeks old, and they scheduled us for a new echocardiogram, which is that ultrasound of the heart, and then an EKG, which is the electrical current of the heart, and checking that. And so we get through that, and they had told us that one of the valves had closed itself, and I'm pretty sure it was the ADP, because they were looking at the PFO again this time. But the PFO had stayed open. Now, apparently, in 25% of people, the PFO is still open, and it really doesn't cause any issues in life unless you're going to go to outer space or be a deep sea diver. So they weren't concerned at all. So they said, everything looks great. He can go on his merry way and live a normal life. And we ended up getting home, which is about a 45-minute to an hour drive for us. And as I'm nursing him and had shared the good news with everybody, I got a call from the doctor herself, which again blows my mind. You know, they have been taking such great care of us at Levine. So I just am like blown away by their service. And she called and said that she reviews all of the images every day before she leaves. So she goes through everybody's images one more time, probably on her own time, and just make sure she didn't miss anything. And of course, in Jet's case, something was found in this second review. And what that was his aorta, which is the main valve coming out of the heart, was slightly dilated, which means a little bit wider or bigger than it should be. So they said, there's no emergency now. Let's schedule an appointment in 6 months, and we will follow up on it. We'll do another echo and just make sure it's trending, it's going down or staying the same, and just kind of see what it looks like. So that was our appointment yesterday. So we showed up to Charlotte. It was, of course, a snow day, but thankfully the roads were completely clear. We were able to get there with plenty of time, park, nurse him a little bit before we went in so that he wasn't starving, and went in and had the echo done, which he did pretty well for now. I mean, he's crawling now. And so to lay on that table for 30 minutes completely still while they did these ultrasounds was difficult, but Josh and I were constantly just trying to keep him entertained and not cry and not grab the leads off his chest. And he did pretty well. So they got the images that they needed. And when the doctor came in, of course, it wasn't the best news that we were expecting. You know, we were expecting, or what we wanted was, it looks great. Totally, you know, fixed itself. Go on home. We'll never see you again. The good news out of this was the PFO that used to be opened is also now closed. So now both of those openings that were in his heart at birth have spontaneously closed themselves. But the aorta, the ascending aorta, is still dilated, and even a little bit more so now. Again, the scoring is a little bit above my pay grade. There's some sort of Z-scores where they take these averages of kids, and they should fall between a -2 and a +2. And Jet's first score on his 2-week appointment was a 2.8. So he was just barely outside that normal range. And then yesterday when he went, his score was a 3.1. So it is gotten a little bit wider, which can be expected as they grow. Again, I'm not really sure how the scale shifts as their body grows. Does the scale change from -2 to +2, or is it always -2 to +2, and he should stay within that range? So She, again, educated us on so many different options and possibilities and what the future looks like, because I ask a lot of questions. And so where we stand today is Josh and I can decide whether or not to get him genetically tested now or wait 6 months and see what his score is in 6 months after another echo. We will be going back in 6 months for another echocardiogram to just see where he's at a year old. And from there, we have obviously some options. The way they typically have been treating this in infants is they put them on blood pressure medication, which was shocking to even hear, like, okay, my year-old baby is going to be on losartan, and that's just mind-boggling to me. But what that does is it takes the pressure, because it's a blood pressure medication, it decreases the pressure that the heart is getting on that ascending aorta, so that it, I guess, naturally by itself, with the help of this medication, will shrink back to a normal size, because there's not the constant pressure from it pulsing the blood through every heartbeat. So she has actually seen very good results with that in school-age children, and I'm not exactly sure, about the infants, but I trust her. And so we have that as an option for treatment at a year old if this doesn't resolve. And then the genetic testing is something we can do now or wait. And at this time we've decided to defer, but it was kind of that, she said, you don't have to make a decision now. Call me if you have any questions, call me if you have any concerns, or if you want to go forward with something or not. And so we decided to wait on this yesterday, and I think we're kind of rethinking that a little bit. We might go through with the genetic testing, but we would meet with a specialist, a pediatric genetic counselor, especially that is focused in cardiology disorders or heart disorders. And I guess there's a clinic out of Winston-Salem. I'm assuming they have like a local location here in Charlotte where we could meet them. I don't think we'd be traveling to Winston-Salem, but again, I don't know. We'll find that out as we go. But what they would be looking for would be a connective tissue disorder. As far as I know, in both Josh and my family history, we don't have that gene present. That does not mean that there could be a recessive gene on both of our sides. That hasn't shown for a while. And if both of us have that recessive, then our kids could have that. And I think that's where my mind snowballs. I know that God has us in control. I know that this was orchestrated by Him for us to find it. The very fact that we knew day one that something was a little bit off with Jet's heart, it could have been completely missed. And honestly, that's something I kind of wonder about in my older kids now, is because if Jet gets tested and he has a connective tissue disorder, we all will get tested. And this could be something that Arlo and Esme have that we have known nothing about. And it honestly could be life-saving. With this dilated aorta, if it isn't fixable, it is going to limit Jet from any type of impact sports or weightlifting. Due to that Valsalva and that pressure that you can cause on the heart, it's more at risk for aneurysm. So thankfully, my kids are in sports, but nothing super high impact right now. And that's, I think, why we're maybe leaning towards doing the genetic counseling sooner than later, to find out if it's something that we need to get tested on our girls and on ourselves, really, to see if we have that recessive trait. Now, we are done having kids. We have our 3. We're not having any more, so it's not something we would pass down to another child. But it's going to be important to know for Arlo and Esme if it's something that they potentially could have and a risk, and something that they need to be having followed as well. We have the follow-up genetic counseling. It's not something that they recommend surgery for right now. I guess they said they're pretty advanced past that. It's not as rudimentary as just cutting it open and making it smaller. But that the medication really has shown good improvement. So it's, again, questions that I have now are, if he's on losartan, will he be on it for the rest of his life? And I think that's why she kind of gave us the option about the genetic counseling, is if he does have this connective tissue disorder, it will mark us, for insurance purposes for the rest of his life. He will always have this, and it might cause costs to go up or issues to arise in the future. But at the same time, it's like you kind of want to know for the safety of your own kids. So, yeah, that's a reality and a possibility, and it's something that we will just have to deal with as it comes. Yeah, so that's kind of where we're at with Jet. You look at him and you could never tell that something was wrong with him. He's meeting his milestones. He's growing. He's nursing well. He looks great. He's never been blue or short of breath or anything. Like there's just no way looking at this baby that you would be like, yeah, there's something wrong with him medically. So a little bit of that is hard to believe for me, because I just feel like he's perfect. But thanks to modern medicine and science and advancing technologies, we're able to know this and see this. And I'm appreciative of everybody's hard work and honesty in the situation and education that's been provided to us so that we can kind of choose the best path for Jet. So what I ask of you is, if you have any positive thoughts, prayers, we would definitely appreciate them. We obviously want the best for him and for us, and to make the best decision. And again, I am not a specialist, so hopefully that made sense to you guys. But yeah, I just feel like it's important to share. I'm sure there's a lot of others out there that have had similar experiences. And it's tricky. It's tricky. I want to say things could be a lot worse. They really could. Things could be a lot worse. I'm thankful that it's not. It's still something that's going to weigh on my mind probably almost every day. Josh was even saying, I feel like I can't even throw him up in the air and play with him, because I don't want something to happen. And that's definitely just a thought in the back of your mind as a parent of a baby. I don't want to be responsible for something bad happening to him before we get something fixed or corrected, if it is a problem. But anyway, I appreciate all your prayers, your good thoughts. If you have had anything, I recommend dropping it in the comments, letting me know, if this has been your journey. I'd love to hear about it, and just, obviously I want to hear positive stories, but I want to hear your journey too. Thank you guys for joining today, and I'll see you next week.